Welcome to today's Explainer. We're jumping right into a topic that affects, well, a whole lot of us, but is honestly so deeply misunderstood. Knee osteoarthritis. We're basing this directly on the fantastic educational guide from Dr. Catherine Pexon, who founded Active Physio Care. We're going to walk step by step through exactly what's going on inside your body right now, and more importantly, how to actually handle it. Let's get right to it.
So I gotta ask you right off the bat, do you have knee pain, stiffness, or maybe just some difficulty walking? Take a second to really think about your day. If you're nodding your head yes to any of those, I want to tell you right now that your experience is totally valid. You're not just imagining discomfort, and you are definitely not alone. You know that morning stiffness that makes you hesitate before taking that very first step? Or that sharp, annoying ache when you've been on your feet just a bit too long? Yeah, that is exactly what we're tackling today.
Okay, here is our quick roadmap for the explainer. We're hitting 1. Understanding your knee pain. 2. The stages of osteoarthritis. 3. Signs and daily symptoms. 4. Conservative home treatment options. 5. When surgery becomes necessary. And finishing up with 6. Your personalized treatment plan.
Section 1. Understanding your knee pain. What is happening inside the joint?
Knee osteoarthritis, or just OA for short, is literally one of the most common causes of chronic knee pain out there. But what is it really? Well, think of it in simple mechanical terms. Deep inside your knee, you've got this amazing stuff called cartilage. It acts just like a protective cushion or basically a shock absorber right between your bones. In knee OA, this cartilage just gradually wears away. It's a physical wear and tear process over time. And as that nice thick cushion thins out, the joint simply can't move as smoothly as it was designed to.
Picture a perfectly healthy knee joint. It's got this intact, robust layer of protective cartilage that allows for beautifully smooth, pain-free gliding. It's like a well-oiled machine. Now contrast that with an osteoarthritic knee, where that crucial protective layer has gradually worn down. When you think about that mechanical difference, it makes perfect sense why the joint starts to feel stiff, cranky, or downright painful. That smooth gliding surface is just compromised.
Moving on to Section 2, the stages of osteoarthritis, how the condition develops.
As Dr. Pexon's guide clearly lays out, this doesn't just happen overnight. Knee OA develops in distinct stages. It kicks off with Step 1, initial cartilage wear. Those are the very first signs of thinning. Then, things progress into Step 2, gradual osteoarthritis development, where the wear and tear becomes a lot more noticeable over time. And finally, it can reach Step 3, advanced stages of knee OA, where the cartilage loss is pretty significant. The really reassuring thing about knowing these stages, it lets you calmly figure out where you might be. It takes the whole panic out of the equation. Because it's such a gradual process, we actually have a lot of time to intervene and manage it effectively.
All right, Section 3, signs and daily symptoms, when movements become difficult. So, because that cartilage is wearing away, the friction inside the joint naturally shoots up. And what does that mean for you? It means totally everyday activities suddenly become a real chore. We're talking about the fundamental movements you rely on all day long. Just walking down the street, climbing a standard flight of stairs, or literally just getting up from a chair after sitting for a bit. If you're feeling pain during these totally normal activities, your body is sending you a glaringly obvious signal. It's saying that the cartilage in your knee is really struggling to provide that cushion you need.
Section 4. Conservative home treatment options. Taking control of your knee health.
Now here is where we pivot from the problem to the solution. The absolutely incredible news here is that you have a powerful toolkit of conservative, non-surgical options available right now. So many people successfully manage their symptoms using these exact strategies. First up, we've got exercise, which aids long-term healing by strengthening the surrounding muscles. That actually takes the pressure right off the joint itself. Then there's weight management. Listen, even a tiny reduction in weight can drastically decrease the physical load and stress on your poor knees. We also have activity modification, things like actively choosing to use handrails or tweaking how you sit and stand to protect the joint. Medication can be a great tool to manage the pain and inflammation. And of course, evidence-based physical therapy gives you a highly structured professional approach to reclaiming your mobility. These are all incredibly proactive steps you can take today to improve your daily life. I want to pause right here because this is probably the biggest takeaway from Dr. Pexon's entire guide. Not everyone with knee osteoarthritis needs a knee replacement. I literally want to say that again. Not everyone needs a replacement. If you've been sitting on the couch worrying that a stiff knee is just a one-way ticket to the operating room, you can let out a massive sigh of relief right now. Surgery is absolutely not an inevitable trap for everyone with this diagnosis. Next up, Section 5, when surgery becomes necessary, the role of total knee replacement. So, let's keep it real. For some folks, usually those in the much more advanced stages we looked at earlier, those conservative home treatments just aren't enough anymore to provide relief. In those specific advanced cases, specialists may recommend a total knee replacement, or TKR. And you should view this simply as a highly effective specialized medical tool. It's meant to restore your ability to move when you've truly exhausted all the other avenues.
Now, if a total knee replacement is the route you need to take, physical therapy doesn't just go out the window. Actually, it remains an absolutely critical puzzle piece. Before the surgery, physical therapy helps prep the knee joint for the procedure, getting it as strong and flexible as humanly possible. Then, after the surgery, PT is downright essential for your recovery and for actually getting that lost mobility back. So whether you're avoiding surgery entirely or you're gearing up for it, physical therapy is basically your constant best friend on the road to recovery.
And finally, Section 6, your personalized treatment plan, next steps with a professional.
So what's the very next step? The most vital thing you can take away from our explainer today is this. If knee pain is limiting your life, please don't feel like you just have to grit your teeth and live with it. It's highly, highly recommended that you consult a skilled physical therapist or an orthopedic specialist like Dr. Catherine Peason at Active Physio Care for a proper, thorough evaluation. Why is this so crucial? Because your knee is entirely unique to you. A professional evaluation gives you a personalized treatment plan, taking all those awesome conservative options we talked about and tailoring them specifically to your body, your lifestyle, and your goals.
Which leaves us with one final, very important question to ponder. Are you ready to take back your mobility and address your knee pain today? You now know exactly what's happening inside that joint, and you know the powerful tools available to fix it. The next step? It's just deciding to take action. Thank you so much for hanging out with me for this explainer. I really hope this deep dive into knee osteoarthritis has empowered you to make the absolute best choices for your health. Keep learning, keep moving, and we'll catch you next time.